All right, thank you everybody for joining us today. We are going to give folks another minute or two to file in here, and then we will get kicked off here in the next 60 seconds or so. All right. Well, hello, and thank you to everyone for joining this afternoon. Today we've got an exciting presentation ready for you. We're going to talk about everyone's favorite topics, compliance and the pandemic. Specifically and seriously, we're going to dig into the convergence of the two subjects. And sort of as we think about the turn of the new year right around the corner and news of a vaccine potentially on or near the horizon, and we're starting to hear more and more from employers about their potential plans to welcome employees back into the office for in-person work again. But the reality is that for most folks, you probably won't even see or be able to get vaccinated in 2021. And planning for an effective return to work strategy for employers comes with many challenges that they've never had to face before, with placing this type of emphasis on the health and safety of their employees, as they will now and into 2021, and we believe into the future. And so with that today, we're going to talk about that, how we safely reopen our doors, the different policies and protocols that folks have to be mindful of as they are opening their doors, and then other things to be aware of, as well as the touch care solution for helping employers do so. And so with that, let's jump right in. Today, I'm pleased to be joined by our head of sales, Angela Marshak. She and her team are quite busy these days working with both our current and prospective clients who are bringing on or are bringing their employees back to work. So her perspective is really unique in this moment in that she's talking to a lot of employers every day about their plans. She'll be around to jump in when I get off track, as well as help us out at the end with Q&A and some of the insights from her conversations in the market with various employers. So a brief agenda here for us. We're going to start by looking at what some of the states are doing from a return to work requirements standpoint, and see if we can't pull some of the common themes between them. Then we're going to dig into the components of a holistic return to work strategy, as well as introduce to you the program that we've created and are implementing with our clients here at Touch Care called Touch Care Shield. Then we'll wrap it all up with some time at the end for Q&A. And I guess stepping back, I introduced Angela. I should have introduced myself. I'm Rob Lehane. I'm the CEO here at Touch Care. And once again, very, very excited to have you all joining us here today. So just to recap and start, and none of this is likely a surprise to anyone, but America and really the world are still very much in the grips of the COVID-19 pandemic. Here in the States, we now have over 12 million confirmed cases. That number grows daily. Unemployment remains at a high rate, still at 7% after hitting peaks of nearly double that back in the spring. And for those of us who are lucky enough to still have gainful employment, almost half of us are working from home. Meanwhile, as discussed at the beginning of the presentation and then kicking it off, many employers are starting to think about how they can adjust their new sense or to our new sense of normal and safely welcome employees back into the office. And surprisingly, or maybe not, many employees actually want to return back into in-person work in the office. In fact, a recent poll showed that over 70% of employees actually prefer in-person work. So all that's starting to come together, and here at Touch Care, a few weeks ago, we actually polled over 500 of our clients regarding their plans to reopen or not reopen their doors and see if we could find any commonalities between the strategies. The results were super interesting for us, but the upshot of it all is that most were planning on bringing employees back to the office at some point in the first half of 2021. And just about all of them were in the process of implementing plans and protocols in order to do so safely and modifying their workplace in some way or another. The emphasis, as you can imagine, has mostly been on really the physical workplace and daily monitoring of employee symptoms, but some employers are even testing employees or planning on it. And the most important thing really for us to focus on, I think, to kick this presentation off, is that only 40% of the employers that we polled had any intention on putting together any sort of a compliance manual or employee handbook for their employees. And we believe that's a glaring hole that needs to be filled in order to both keep employees safe and keep employers or yourselves out of trouble with the Department of Labor as you do bring employees back into the office. And so what we're seeing and what we've seen over the last couple months, really, it's starting to ramp up as more and more employers and states are relaxing mandates and guidances, is that all states have really taken measures to provide some sort of guidance to employers on how to reopen their doors. At TouchCare, we've actually been working on a compilation or a big working document, really, of all 50 states and their various recommendations and protocols around return to work. And since it would be impossibly long for us to really go through each one in this presentation, what we tried to do was pull out some of the common themes that we're seeing in each state as we kind of go through. So the enhanced safety protocols, most of the states recommend at some level social distancing, masking, and changes to the physical office layout in order to keep people away from each other, and then also some level of daily symptom or health monitoring. Additionally, most states that we're seeing are actually requiring employers to provide personal protective equipment, PPE, as well as hand sanitizer and other stringent cleaning agents or cleaning protocols around keeping the workplace clean and disinfected at no cost to employees. So routine cleaning and disinfection is almost a universal requirement. And then lastly, of course, most states are requiring that there's masking for all of the employees and all of the visitors at some level. Specifically, and since we're headquartered in New Jersey, we decided to pick them out. Plus, they made news recently by sort of doubling down and coming out in a big way with their guidance. And so, TouchCare, like I said, we're headquartered in New Jersey. Many of our clients are in the tri-state area and either have employees who work or live in New Jersey. So we decided to focus on the recent New Jersey executive order known as the Murphy Mandate from Governor Murphy that went into effect on November 5th. As you can see, the governor specifically outlines many of the same requirements of other states, with individuals being required to keep at least 6 feet of distance between one another. Employees and visitors are required to wear masks in the workplace. PPE and sanitizer are required fixtures in the office now to be paid for by employers. And lastly, there's this introduction or requirement of this concept of daily symptom monitoring or daily health monitoring for employees that needs to be implemented if you are a New Jersey employer and looking to bring your employees back. At TouchCare, we've been building a program with our employer clients and for our employer clients really dating back to March. Initially, our focus was on providing employers with information and resources related to COVID, but since has really shifted into helping employers stay compliant with their return to work strategy by bundling together as much of the employee experience for returning to work and making it as easy as possible by offering a centralized solution that we've introduced and called TouchCare Shield. And the reason we introduce this and bring it up is there's really 4 or 5 main components of the TouchCare Shield program, but where it all starts is with the creation of a compliance handbook. So looking back on our own internal survey results, like I said, only about 40% of employers are working on or have a compliance handbook for employees related to their return to work protocols. we sort of firmly believe that this is the most important first step to any employer's return to work strategy. From a communication standpoint, it helps your employees with clear and thorough messaging around what the steps are that you as an employer have taken to ensure their health and safety at work in the middle of a pandemic. And then from a compliance standpoint, it ensures that employers are putting into action any required protocols that your state or states have issued as a part of your return to work mandates that will really keep you protected against any sort of claims with the Department of Labor by either any of your employees or a random inspection, et cetera. And so what we've done is at TouchCare is over the past few months specifically, we've been working extensively with a team of HR consultants and employment lawyers to develop a comprehensive compliance handbook for employers. The handbook is extremely thorough, covering everything from your state required protocols to the little things that you might not think of, like the office snack policy and what you do around common spaces. The handbook is customizable, and when employers sign up for the program, they're offered a call with one of our HR consultants to go through the handbook line by line and literally edit the policy to their liking so that then they have something that works for their unique work situation or their unique return to work protocol that you can then hand to your employees, have your employees be very aware of what those safety measures and protocols are, and then of course have something to point back to as a working, living document that you can show the Department of Labor in the event that something does come up. So we think this is really an important first step, and what we hear a lot from employers that we speak to is that they don't even know where to start, so they're not considering bringing their employees back into the office. And so what we've tried to do is try to give you a little bit of a head start by creating, like I said, that out-of-the-box playbook that you can then customize and bring to your team and say, this is ultimately what we're going to work from. We're going to be able to customize it to meet the level of standards that we want to implement with our employees. And of course, we will make sure that everything in there is compliant with any state requirements. And so, for example, we talked about the next component here, it's the return to work program, which is the health screening, which is now something that is required by New Jersey and many other states. And so with our program, what we've done is we've built a health screening tool and layered in expert healthcare concierge support. So as I mentioned, because many states are requiring that employers perform daily health monitoring for their employees, it sounds like a really simple task, but putting a program in place that makes it easy is not necessarily simple when you think about all the logistics around how you get folks to answer a daily symptom monitoring questionnaire or a daily health screening questionnaire. You need to make it really easy. You need to leverage technology in order to make it work. And then you need to be able to give employees the expert help they need, should they have any results that render them unable to come to work that day. And so what we've done is we've literally built an easy-to-use technology solution to solve for the daily health screening of our clients and their employees. The tool was built using guidance from the CDC on which questions to ask and ultimately how to classify employees based on their responses, and it's really quite simple. Each day, employees get a push notification or a text message asking them to complete their daily health questionnaire. And then based on those answers, employees are assigned red, yellow, or green status on whether or not they can come to work. And then meanwhile, the back end of this provides reporting back to HR or whoever the designated employees are on the other end, who are able to see who has and who has not completed the survey before entering the building. They're able to see the health status of employees so they know who is and who is not going to be in work that day. And then from there, we can refer folks to the compliance manual to determine the next steps based on, a red or a green or a yellow result. The core service offering that we offer here at TouchCare pre-pandemic is, of course, our expert health navigation, our healthcare concierge service, which is layered into this program to provide employees and their families with expert support for really COVID and non-COVID related needs. And especially as it relates to the daily health questionnaire, with folks who receive a red or a yellow status, the question always is, all right, so what now? What do we do next? And we can refer folks, as I mentioned, back to that employee handbook or compliance manual. And then TouchCare's team automatically can reach out to help the employees with next steps and or any medical needs that they may have at that time, to be able to provide them with guidance on whether or not they should return to work, or they should quarantine, they should seek a medical consultation, etc. As we sort of progress into the additional services around what is, the effective TouchCare Shield program and return to work program, we're finding that COVID testing and some sort of testing is becoming more and more popular. Back to our survey results, about 20% of employers right now are either testing or are thinking about testing their employees when they bring them back to the office. We're starting to see those numbers rise pretty dramatically as the testing technology changes, as the tests tend to get less and less expensive and more rapid. And so we're dealing a lot with this here at TouchCare. And so kind of putting all the pieces together and into place around office layout, cleaning, daily health screening, et cetera, they're all great steps in welcoming your employees back to the office and making folks feel safe and creating a safe work environment. But really, at the end of the day, the only surefire way to know whether or not your employee population has an infection is to actually perform some sort of testing. And so we see this, like I said, take many shapes and forms here at TouchCare, but we've also created a part of our solution in actually providing testing options to our employer clients for their employees to make it super easy from a administration, ordering, and ultimately reporting standpoint through partnerships with labs that we've created. And so, kind of digging in a little bit more on testing, it's a super interesting subject because it's constantly evolving. I probably know way more about testing now than I ever would have thought I would know about diagnostic testing, which has been, I guess, a fun personal aside. But looking back to the beginning of the pandemic, the strategy around which tests to use or not, or which ones are most recommended has changed numerous times. But sort of through the entirety of the process, the thought has been and the messaging has been from health officials, from the government, et cetera, that more testing is better. And so as technology for testing tends to continue to evolve, we're starting to see them get simpler. We're starting to see them be simpler to use and more effective and more affordable. And employers who are interested in surveillance testing are starting to gain more and more options. However, there is a compliance side to testing as well, right? It comes with its own compliance hurdles. And so, for instance, the Equal Employment Opportunity Commission, the EEOC, actually stated that viral or rapid antigen testing can be a part of a requirement for employees to come back into the office, but antibody testing, which was very popular sort of in the beginning of the sort of testing timeline that we just went through, is not. In addition to that, you've got all kinds of challenges around whether you offer testing in facility, on site, at home, whether or not insurance is actually going to cover it. And all these are pieces to the program that TouchCare and our team help out with. And so looking at kind of the most popular options around testing and a little bit of detail on the difference between the different options, the fact is that there are many, right? And some employers are doing on-site testing with actual nurses or lab techs coming on-site, performing nasal swabs and testing their employees, while some employers are providing employees with easy-to-use saliva tests that can be self-administered. And more, we're starting to see employers who are interested in rapid testing as a solution for their employees. Rapid tests tend to be less expensive than traditional viral tests, but they're also less accurate, so there's a lot to weigh there. At TouchCare, we offer easy-to-use saliva viral tests. These tests are used to detect an active infection. They're also known as PCR tests. our tests are able to be ordered in bulk and self-administered by your employees or the family members, meaning that a doctor is not required to oversee someone actually performing the test. And then our integrations on the back end with the labs make the actual reporting of the results quite simple and automated directly back to the employees. And then, of course, we can provide reporting back to HR and the employer level as well. And so, as I mentioned, TouchCare, we've been working on sort of an ever-evolving TouchCare Shield program for months now. And our longest tenured client in the program, it's actually a client that we worked with on developing the program, makes for a really interesting case study. This group actually brought their employees back to work on June 8th. As you can imagine, they did have some complaints between June 8th and call it the end of August with the Department of Labor amongst employees who were not wanting to come back to work yet. But because we had a compliance handbook that had been put in place that we could refer back to, and we were able to prove out all of the systems and processes that we had in place, nothing ever came of any of it. And this was back, like I said, in early June, well before most were even thinking about bringing their employees back to work, especially in New York City, which was sort of the initial epicenter of the pandemic. So we work closely with our client and the HR and executive teams to layer our program into the other protocols that they were taking around office sort of renovations, if you will, moving desks around and safety checks that they were implementing. And so then we also introduced a weekly testing requirement for all employees. So every Monday morning, literally everybody in the company, 200 employees every week, takes a test at their desk, and then the tests are mailed off in a box to the lab every Monday afternoon. And around Wednesday or Thursday, everybody gets their result. And in doing so, we've actually caught 8 active infections, which we were able to quickly notify and contact trace back through the employee population. And by doing so, we've been able to ensure that there's been zero spread of the virus with this client. And while the investment for this company has been great, just in terms of the sheer cost of the tests that they've had to put forward, their stock during this time has actually tripled, and since they've been back to work. So since June, the stock has literally tripled. It's a public company. The CEO and the executive team believe that the productivity of the company has been dramatically impacted by having one back at the office, specifically from a creativity and a cross-departmental functional standpoint, getting folks together and being able to push projects forward in more of a traditional fashion. And ultimately, we can't obviously take complete credit for their stock tripling over time, but we do think, and the executive team there does speak very highly of the program for helping out with those results, because of the fact that we were able to bring everybody back and no productivity was really lost since that time. And so as we sort of round out the program, we look at the additional virtual support that we can offer. Really the final pieces to the TouchCare Shield program are virtual medical care. And so during the pandemic, much has been made about the boom in telemedicine. And at one point, telemedicine visits really over the last, well, I guess not at one point, from September 2019 to September 2020, there's been almost a 3,000% increase nationally in telemedicine utilization. And so employers have placed a big focus on making sure that employees have access to telemedicine. And most providers have jumped in and also become more on board with offering virtual visits to their patients. And so we're seeing obviously big trends and increases in folks who are looking to have telemedicine as a mandatory part of their benefit strategy moving forward. And the predictions are that demand for telehealth is going to soar by over 64% in the US next year. So our telemedicine program actually provides a simple one-click support and access program to a doctor, whether the illness or the issue is COVID related or not. Our virtual urgent care program makes it super easy and convenient for people to get the care that they need, but also helps keep them safe by ensuring that you don't have to enter a potentially infectious doctor's office or emergency room for something that might be relatively minor. And another trend that we're seeing a lot of during the pandemic and really even leading up to the pandemic has been the rise in awareness and offering of virtual support for mental and emotional well-being amongst employers. And so prior to the pandemic, what we sort of had was a mental health crisis in America that was driven by far too many folks with mental health needs going unaddressed. And one of the biggest issues there was really the lack of access being really the biggest barrier to folks finding care. But during the pandemic, you sort of combine lack of access or lack of ease of finding care with the fact that, quite frankly, going to a therapist office or going to get in-person care was really shut down in a lot of places for a while. And then that all kind of mixed together with the pandemic causing feelings of isolation and lack of socialization, which have sort of led to this heightened awareness of our societal mental health needs. And so it really sort of highlights the need for programs for programs that address employee and employee families' mental health needs. And so we actually launched this service right at the beginning of 2020. So it was good timing in the sense that we were fully prepared to support employees and their families during the pandemic as well. But our virtual therapy program that we call Mind Care actually offers employees and their family members access to one-on-one mental health support with licensed providers and guaranteed appointments within 24 hours in a virtual setting. So, a virtual meeting like a FaceTime or a Zoom type of meeting, all done through a HIPAA secure compliant platform. The different levels of therapy range from your basic psychological needs all the way up to full-blown psychiatry, and even child and teen therapy is offered as well. And so given the mental health toll that the pandemic is taking on folks, combined with sort of the already challenging access problems that we discussed on the previous slide, people who need, and for people who need the support, we believe that Mind Care is an important component of an employer's return to work strategy, or really just their overall benefits planning and strategy for 2021 and beyond. We just see this as really a growing need that is going to continue to be more and more relevant now and into the future. And so just real quick to review, the TouchCare Shield program is built to create a safe work environment that provides the right mix of support and tools to make it easy to welcome employees back into the workplace. And as a part of the program, we also offer access to easy-to-use viral testing for employers who are taking that additional step in maintaining a safe workplace by either offering one-off testing or doing full-blown surveillance testing of their employee population. But at the end of the day, I can't really stress enough that all of it begins with the creation of a handbook and making sure that your protocols are in line with and compliant with your state requirements. And so that's really the first step to the program. And we at TouchCare are happy to help make that a reality for folks who don't know where to start. And so as this continues to evolve, we continue to make sure that we're staying ahead of things for our customers. Like I mentioned, the health and safety of your employees is really now an area of focus that most employers have never had to think about in this way, right? Sort of diagnostics and the daily health and symptoms of your employees has never been really at the forefront in a way as much as it is now. And heading into, or kind of right in the middle of getting started with the flu season, it's going to be even more and more important as we kind of head into the winter months and folks start to think about how they bring people back. So bringing employees back should include protocols that, of course, make everyone feel good and make everyone feel safe and like their workplace is a safe place for them to come and go and remain healthy. And also important to that is that the programs and the protocols are in line with any state or federal requirements that you may be subjected to based on the location of your office and your employees and really the week-to-week changes that are occurring on a national level. And so we're here to help out with making sure that is achieved, and that your programs are both safe and work for you, but also focus on making sure that you're in compliance with whatever state regulatory mandates are necessary. And with that, I think we're going to head into the Q&A. We do have a handful of questions that have already come through that I can just field here and jump into, and I might ask Angela to jump in and help out with some of those. But with that, I'll jump right in. So the first question is, will TouchCare Shield facilitate with vaccine distribution? That's a great question. We are actively exploring that now. It seems largely determined that the initial batches of the vaccine will be focused on frontline and healthcare workers as the initial priority, and then shifting probably to folks who are at risk in terms of their age. So really, it seems like the focus will be those who are over age 65. But eventually, we do see this as and mostly because of the dynamics of the vaccines that have already been approved, right? They require multiple doses to be effective. It seems as though these are going to be vaccines that are going to be required annually, sort of like a flu shot. And so we at TouchCare are actively exploring how we can insert ourselves into that process to make it easier for employers who are potentially offering vaccines as a part of a wellness program or a wellness event or something like that to actually be able to come on site and offer that. That is not something, obviously, that we have hammered out yet, but it is something that we're exploring. So, great question. We hope to be able to solve for that in the coming months and years. The next question is, can the policy handbook be sold separate from the Shield program? Right now, we offer the policy handbook as a part of the Shield program, but the Shield program can actually be customized to a couple different degrees. I can let Angela, if you want to jump in and expand on that a little bit more, but basically it's modular in the sense that you don't have to do full-blown testing, you don't have to do the virtual medical support, and you don't have to do the daily symptom monitoring as well. So you can sort of piece it together. And so I would just say let's have a conversation about that if that's something that you're interested in. The next question is there a minimum order for COVID tests? We do have a minimum order for our bulk orders, and that is for employers who are looking to order a bulk order of tests for their employees of 25. And really what that does is it gets you discounted rates on the tests. Anybody who's looking to order less than that, we actually do offer our tests on a business consumer, a B2C stand basis as well. So we are able to fulfill orders all the way down to 1, but you do start getting into discounts once you get to 25 on the employer side. And so there's no minimum in terms of order size, just a matter of whether or not we can offer you the lower discounted rate and discounted shipping and things like that. One more question just came through. Can you share this presentation with your viewers? Yes, yeah, we'll share the presentation around afterwards as well, and make sure that everybody has a copy of it. So, and that is it for the Q&A. So if there are no more at this point, I'll go ahead and wrap it up. There's Angela's information. You can also contact us at the sales@touchcare.com. Email from the previous slide. Fastest way to get a response, though, is probably to reach directly out to Angela. Her information is right here. And we appreciate everybody's time and joining us today. If you have additional follow-up questions, we'd love to hear from you. And Have a healthy rest of the week. Thank you.